Is there an age limit for Wegovy in older adults in the UK? That's exactly what we're covering today. And the answer is more nuanced than a simple yes or no. Before we dive in, a quick note. This video is for general information only and isn't a substitute for medical advice. For personalised guidance, please speak with your GP, pharmacist, or specialist. This content reflects UK licensing and NHS guidance. So, is there an upper age limit for Wegovy in the UK? Technically, no. There's no cut-off age written into Wegovy's UK licence, but that doesn't mean it's straightforward for everyone, especially older adults. Wegovy contains semaglutide, a GLP-1 receptor agonist. It works by reducing appetite and slowing the rate at which the stomach empties, helping to support weight management. In the UK, it's licensed for adults with a BMI of 30 or above, or 27 or above, if there's at least one weight-related health condition. NHS access through NICE is more specific. It involves higher BMI thresholds, certain comorbidities, and access through specialist weight management services, typically for up to 2 years. Now, here's where age becomes relevant. While there's no upper age limit in the license, clinical trial data for people aged 75 and over are limited. That means we have less evidence about how well Wegovy works and how safe it is in that age group compared to younger adults. This is why individual assessment is so important. For older patients, prescribing decisions need to account for overall health, existing conditions, frailty, and nutritional status. Tools like the Clinical Frailty Scale can help clinicians identify who might be at higher risk of complications. One of the key concerns with weight loss in older adults is sarcopenia, the loss of muscle mass. Losing weight can sometimes accelerate muscle loss, which can affect strength, balance, and independence. Bone density is another consideration, as is the risk of increased frailty if weight loss is too rapid. Older adults can also be more susceptible to the gastrointestinal side effects associated with semaglutide, things like nausea, vomiting, and reduced appetite, which can raise the risk of dehydration and inadequate nutrition. The potential for interactions with other medications also needs careful review, particularly for people managing multiple conditions. When it comes to dosing, your prescriber will determine how to start and adjust your treatment based on your individual circumstances. This isn't something to manage yourself. Always follow your clinician's instructions and never adjust your dose without speaking to them first. If you or someone you care for is an older adult considering Wegovy, here are some useful questions to raise with your doctor or specialist. Ask whether weight loss is clinically appropriate given your overall health. Ask about the risk of muscle loss and what can be done to protect against it. Resistance exercise and adequate protein intake are often part of that conversation. Ask whether input from a dietitian or physiotherapist might be helpful. And ask about alternatives because lifestyle modification, dietetic support, and resistance-based exercise remain important options for older adults, with or without medication. If you're already taking Wegovy and you notice significant nausea, vomiting, or reduced appetite that's affecting your ability to eat and drink, contact your doctor. The same applies if you notice unexpected weakness, dizziness, or any signs of dehydration. For urgent advice, contact NHS 111. And in an emergency, always call 999. So to recap, Wegovy has no absolute upper age limit in the UK, but the evidence for people aged 75 and over is limited. Prescribing in older adults requires careful, individualized assessment, weighing potential benefits against real risks like muscle loss, bone density changes, and frailty. Shared decision-making with your healthcare team is essential. If this raised questions for you, drop them in the comments below. We read everything. And if you found this useful, please give it a like and subscribe to the Bolt Pharmacy channel for more evidence-based health content.